Major Medical Insurance and Managed Care. Business 506, Cal Lutheran University. Some of the objectives of today's lecture are to discuss basic indemnity plans and major medical coverage, describe different types of managed care plans including HMOs, PPOs, and POSs. A brief history of health insurance, how it's just evolved over the last 100 years. Well, going back to the 1920s, the first HMO was created shortly, and roughly a decade later, the birth of the Blues, Blue Cross Blue Shield. Insurance stayed fairly static for another 2 decades or so until the insurance companies introduced major medical coverage. Shortly thereafter, Medicare and Medicaid were introduced in 1964. The HMO Act of 1973 standardized many of the provisions related to health maintenance organizations. In 1974, ERISA came into play, and that was passed, that legislation. And in the 70s and 80s, the growth of self-funded plans, PPOs, and POS plans. Some of the basic plans were indemnity plans. Prior to the 1970s, most employees were covered under these plans. Typical benefits under these basic plans consist of hospital expenses, surgical expenses, and physician's visits. Some of the hospital expenses that were covered are inpatient benefits, room and board, other charges in the hospital such as drugs, x-rays, operating room expenses, and outpatient benefits such as pre-admission testing, lab work, and emergency room treatment. Some of the things excluded under these policies were occupational injury covered by workers' compensation insurance, cosmetic surgery, and most physical examinations. Deductibles and coinsurance generally do not apply, but a maximum amount that will be paid is substituted. Again, that is the basic plan. Some of the surgical expenses covered on the indemnity plans are the reasonable and customary physician's charges associated with surgical procedures. Some things typically excluded: occupational injury covered by workers' comp, cosmetic surgery, and dental surgery. Regarding physician's visits on an indemnity plan, what was covered was the attended physician's charges other than surgeons while hospitalized. And as far as the exclusions, everything that we've talked about already up to this point: occupational injury for work comp, cosmetic, dental, and also physical and eye exams. Now, on major medical, most insured people desired greater coverage than was provided under the basic plans. So this helped create the major medical insurance concept. So there's 2 types of major medical plans. One is supplemental plans, and the next is comprehensive plans. Supplemental or superimposed plans coordinate with major medical coverage with basic plans, including expenses not covered under the basic coverage, expenses that have been exhausted under the basic plan, and specifically excluded expenses. Here's a graphic talking about for hospital and surgical and other expenses. The basic coverage would take care of hospital and surgical. There would be a deductible on major medical, and then major medical would kick in on those. Now, for other expenses where the basic coverage did not come into play, the deductible starts immediately, then major medical takes over subject to coinsurance. A comprehensive plan is a single medical contract that covers all medical expenses. So it's a simple, straightforward, no basic plan to worry about. Is this covered? Is this not covered? Just everything's going to be covered, and you'll have your deductible and coinsurance. Some of the characteristics of major medical include hospital room, board, and other charges, outpatient surgical centers, administration of anesthetics, doctors and professional nursing services, prescription drugs while in the hospital, physical and speech therapy, x-ray, lab work, radiation therapy, prosthetics, durable medical equipment, and ambulance services. Some of the exclusions: well, occupational injuries to the extent covered by workers' comp, services furnished by government agencies, care provided by family members, cosmetic surgery with some exceptions. Those exceptions are when the cosmetic surgery is non-elective. It's because of trauma or disease. Then the cosmetic surgery is going to be covered. Most physical exams were excluded. Convalescent and custodial care, dental and eye care, eligible Medicare expenses, as well as experimental procedure. Those are the exclusions. On the topic of pre-existing conditions, generally defined as any condition for which the covered person received medical care during the 3-month period prior to the effective date of coverage. Usually this exclusion would expire after the early of 3 consecutive months during which no medical care is received, or 12 months of coverage under the contract. A note about pre-existing conditions. The changing healthcare landscape in America right now is a number of state exchanges are coming online. In California, it's called Covered California, where regardless of your current health and your pre-existing conditions, you can get coverage. So again, part of the dynamic changing environment that we have for health coverage. Some of the limitations on major medical. These policies contain what we call internal limits, so a sublimit, so to speak. Hospital room and board limited to semi-private accommodations. For example, if a private room is $1,500 a day as a base charge, and a semi-private room is $1,000 a day, well, the insurance company is only going to pay that $1,000 a day. Next point, daily dollar limit on extended care facilities. Dental, vision, and hearing care, when included, are limited to a fee schedule and annual limitations. And the last point, generally coinsurance on infertility treatments. So some treatments limitations. They may be limited for mental illness, alcoholism, and drug addiction. They may, for alcoholism or drug addiction, the company might provide, for example, one-time coverage during your lifetime or during a certain number of years. Again, read the contract to see what the specifics are for the client. On the concept of deductibles for major med, the deductible is the initial amount of covered expenses that a covered person, the insured, must pay before benefits are paid under a plan. So we have a couple types of deductibles. One is the initial deductible, and that's the most common. The covered person pays the first X amount of dollars of covered expenses. A traditional PPO might be $500. A high deductible health plan might be a couple $1,000s. Again, deductibles are also a way to cost shift that was reviewed in a prior presentation, as well as control the premium for the client. Second bullet point, corridor deductible. No benefits are paid under major medical plan until all the benefits under basic coverage have been exhausted. Continuing on with deductibles, calendar year deductible. The deductible only has to be satisfied one time during the calendar year. So if you get sick in January and you meet the deductible, and then in July you break your leg on vacation, you don't have a second deductible that year because you've already met it for the year. Family deductible. Covered expenses of all family members are accumulated for satisfying the deductible. So let's say you have 3 children, and all 3 children get colds and flu during the winter, January, February, and you've met the deductibles for 2 or more of the children. Well, depending on how the contract is written, somebody else gets sick later in the year, whether it's one of those kids again or a new family member, the mom or the dad. Well, if the family deductible has been met, all other family members for that year don't have to satisfy any deductible. We also have a common accident provision. Only one deductible has to be satisfied if 2 or more covered persons are injured in the same accident. So they impact a car accident, for example. 4 family members, they're all hurt, that you don't have 4 separate deductibles. That common accident provision would just have one deductible in that scenario. We've already talked about initial year. In this example, this client has a major medical policy with a $200 deductible. She goes to the doctor in March and has $175 in expenses. Since she's not met her annual deductible yet, she pays these expenses out of her own pocket. Now in June, she goes to the doctor again and has $350 in expenses. She'll pay the first $25, the remainder of the annual deductible, to satisfy her requirements, and the insurance company will pay the remaining $325. On the family deductible, we just talked about this a couple slides ago. Coinsurance, important concept. Most major medical plans contain a provision that limits the amount of covered expense the insurance company will pay to a certain percentage of total expenses. coinsurance usually apply after the deductible is met. So an example, assume that Margie has a major medical plan with a $200 deductible and 80/20 coinsurance clause. She incurs $20,200 in covered expenses. So first we take the deductible off, bringing the remaining expenses to $20,000. 80% paid by the insurer of the remaining $20,000 would be $16,000, leaving 20% of the $20,000, $4,000 to be paid by Margie. Stop loss limits. Some major medical plans include a stop loss limit which caps the insured's out-of-pocket. So for example, on the prior page, if Margie's policy had a stop loss limit of $3,000, she would have had to pay $3,200 out of her pocket and the insured would have paid $17,000. Moving on to managed care. Managed care is a generic name for medical expense plans that provide covered services to their members in a cost-effective manner. There's a few different types of managed care plans. Health maintenance organizations, here in California, and actually even across the nation, Kaiser Permanente is the nation's largest HMO, very popular one. There's other ones out there, I'm not endorsing them, but they're a common name in the marketplace. Next you have preferred provider organizations, exclusive provider organizations, and point-of-service plans. Some of the characteristics of managed care. Controlled access to providers, emphasis on care management, encouragement of preventative care, risk sharing between plan and medical providers, and careful selection and monitoring of medical providers. HMOs, or health maintenance organizations. They're an organized system of healthcare that provides comprehensive services to their members for a fixed prepaid fee. Some of the characteristics of HMOs. They're responsible for organizing and delivering comprehensive health to their members. They provide broad comprehensive services, most of which are covered in full, and there may be some adjustments by different insurance carriers. You might see a $30 doctor copay instead of $0, a $100 emergency room admission fee, things like that. But generally, for an HMO, the out-of-pocket expenses will be lower than for a PPO or POS. Third bullet point, selection of physicians, usually limited to those who are affiliated within the HMO itself. Members pay a fixed prepaid fee for the medical services provided, and there's a heavy emphasis on controlling costs. Some of the types of plans that we have. The staff model HMO. Under this model, physicians are employees of the HMO and paid a salary and an incentive bonus to hold down cost. The group model HMO. Under this model, physicians are employees of another group that has a contract to provide services to the HMO. The HMO pays the group a monthly capitation fee for each member. So the capitation fee under that group model. Let's say the HMO agrees to pay $100 per member per month, and there's 100 members. Well, that group model HMO would pay out $10,000 to that medical group, regardless of the number of people that come in. Types of HMOs. There's the network model HMO. Under this model, the HMO contracts with 2 or more independent group practices to provide services to the HMO. The HMO pays the groups a fixed monthly fee, and the group decides how the fee is allocated amongst its physicians. And last, we have the Individual Practice Association, or IPA. Under this model, an open panel of physicians works out of their own offices and treat members on a fee-for-service basis at reduced rates. And the mixed model consists of 2 or more of the models previously described. PPOs, Preferred Provider Organizations. It's a plan that contracts with healthcare providers to provide medical services to members at reduced fees. Some of the characteristics. Unlike HMOs, they do not provide medical care on a prepaid basis, but are paid on fee-for-service. So as clients come in, that's when the fees are going to be charged. Unlike HMOs, patients are not required to use a preferred provider, but have the freedom of choice out of network. Understanding that if you go out of network, the client will have more out of pocket. Network providers provide services at negotiated or reduced fees. In-network services are provided at lower deductible and lower copay levels than out-of-network services. So it's beneficial to the client to stay within the network from a cost perspective. However, if there's a specialist that can really take care of them, it may be worth the extra cost, and you have the flexibility to go outside of the network. EPOs, Exclusive Provider Organizations. It's a plan that does not cover medical care received outside of a network of providers. Members receiving medical care outside the network pay for it on their own. Point-of-service plans. They're a plan that offers a full range of health services through a combination of both HMO and PPO characteristics. So some of the characteristics are choice of service. Members can elect to receive services under the defined managed care programs or go outside the network for care. So in-network services work like an HMO with little or no out-of-pocket expense, and out-of-network services work like a PPO. Substantially higher deductibles and copay would be incurred by the client in that scenario. Here's a comparison showing on the left various aspects of care and cost of care, and across the horizontal top axis we have traditional major medical, PPOs, POS, and HMOs. You can just take a moment, look at this, and see some of the different characteristics, or just hit pause on your player if you need to see it for a while. To sum up, we've reviewed some basic indemnity plans, major health plans, and managed care plans. As always, thank you for your time.